Hey, future medics, Tina here, your medic mentor, and today we're breaking down a cardiac med that is great for slowing things down when that heart is trying to race out of control. It's Diltiazem with a brand name of Cardizem. This one is part of the calcium channel blocker family. So here's how it works. Cardizem will slow the conduction of electrical impulses through the AV node specifically, and that will help calm down the rate. Also important to know, calcium is an important part of a muscle contraction. So if we decrease the amount of calcium that can be present by using a calcium channel blocker, we decrease how many contractions can actually happen, therefore controlling the rate so it cannot get out of control again because it doesn't have the supplies it needs to do so. Isn't that interesting? Fascinating. So this is great for rate control, like I said. So we're going to use that in patients like atrial fibrillation with RVR, flutter patients, supraventricular tachycardia patients, anytime that heart is just running out of control. Let's talk about the dose. This one's a little interesting. I don't think we've really seen this one before. The initial dose is 0.25 mg per kg, and that's going to be an IV push and a slow one at that. Needs to at least be over 2 minutes. Push this slow. So 0.25 mg per kg, we're going to push that. If in 15 minutes that hasn't helped, you're going to do a second dose, but it's not the same. It's not the same. The second one is 0.35 mg per kg. We're going to up it a little bit. And that one, still push it slow, still push it slow. Okay? And if that works, when you get to the hospital, they'll probably go ahead and put them on a maintenance drip. But we just do the pushes, no drips. Okay? The onset of this one, super fast. It's like 2 to 5 minutes. So yes, if you haven't seen it make a difference in 15, definitely give that second dose. And the duration, 1 to 3 hours. It'll control things for quite some time. So let's look at the side effects. Huge one, it's going to be hypotension. We're lowering someone's heart rate. Blood pressure goes with that, right? So they're very probably going to become hypotensive, so keep a really close eye on that. Second, bradycardia. We're lowering their heart rate on purpose. Make sure it doesn't get too far out of control. And then we might see like dizziness, fatigue, things like that. Contraindications are really interesting. So contraindications obviously going to be hypotension or bradycardia. Of course, that makes sense. It is contraindicated in sick sinus syndrome. Try to say that 3 times fast. That's a contraindication. Also, high degree heart blocks. The really interesting one is Wolff-Parkinson-White. Shorthand is WPW, Wolff-Parkinson-White. If we give Cardizem to a patient in AFib who has Wolff-Parkinson-White, it actually worsens their underlying condition of WPW and can send them into a lethal rhythm. So be really careful with this. Now, I've met a couple of patients who do have WPW. They all knew that. Every single one of them. They all knew that they had it. So ask. Don't get surprised by this one. Here's your takeaway. Cardizem is great at controlling runaway atrial rhythms. But you have to know the rhythm. Make sure you don't just blindly push this and you know what you're pushing this for. And then be ready to manage the hypotension that's going to come. We expect it. We know how to take care of it. It's going to be fine. But that's it. That's another medication done. You're doing such a great job. I'll see you for the next one.